Friends, how's it going? Welcome back to Male Nurse Mentor. My name is Jesse. Bedside, hospital, do you have to work there? Let's talk about it. So friends, welcome back as always to the channel. Today I have a very special question. It's one that hits pretty close to home for me. It's one that honestly I was always very worried about. I didn't grow up wanting to become a nurse. That's not something I've always wanted to do. So, when it came to it, I had to make a decision. Going into the workforce, was I going to go work in a hospital? Was I gonna go work bedside? Do the thing that everybody was telling me to do? Or was I gonna go against the grain and just kind of pave my own path? So we'll talk about it here, friends. At the very end of the video, I'll tell you ultimately what I think. Do you have to work bedside? Do you have to work in a hospital? Coming from the perspective from somebody who never worked in the hospital, at least in the professional workforce. I did it during clinicals, but it's a little different, right? All right, friends. Had to turn off my heater there for a second, but we're back. We're back now. So in this video, friends, I want to cover a couple questions. There's a couple questions that I think are important, and we'll kind of break them down one by one. But the first one, I want to speak on my nursing school experience, what it was like for me with this mindset, right? Of how do I avoid the bedside? How do I avoid the hospital? Hearing everybody tell me you have to work there. I'll kind of speak on that a little bit. I also want to talk about specifically why I don't like the hospital. There's a couple reasons why. Maybe you can relate to them. Maybe you're in total disagreement, but either way, maybe there's something to be learned there. And then the other thing I want to talk about is how I was personally able to avoid the hospital. And then lastly, friends, I want to end the video by actually just giving some advice, some general advice of, do you need to work in a hospital? Answering that question. So if you want to get to that question, just go to the timestamp to the end of the video. You can skip a lot of this, but either way, friends, I think there's a lot of value in this video. You're not alone if you feel this way. I was very in the minority in this sense of feeling this way, thinking that, hey, I'm not going to be a good nurse because I feel this way about the bedside, about the hospital. But, let's talk about it, friends. You're not alone. I'll tell you that. You're not alone. So kind of going back to nursing school, friends, there's no way to avoid the hospital. There's no way to avoid the bedside. But there's some positives. You're going to have to get your clinical hours, and through these clinical hours, you're going to realize, hey, do I like working in a hospital? Can I see myself working here? As you kind of go to do your rotations, med surge, ER, ICU, pediatrics, labor and delivery, you're going to kind of get exposed to different areas. You're going to see which one you typically like more. And then when it comes time to apply later on when you graduated, you're going to be like, oh, I can see myself more in the ER. So you're going to apply to ER positions. Well, maybe you might be like me, friends. Maybe you're going to go through all these rotations, and then at the end of it, you're going to be like, I still don't like any of these. I can't see myself working in a hospital, right? Public health is not that cool, like psych is okay. It's like you start to realize you don't really have a home, right? So you put all this time in to become a nurse, and you're not really seeing somewhere you want to work. That's 100% me, friends. I can relate to you. For me, I ended up finding a home in corrections, right? That's what I ended up doing. In nursing school, everybody's gonna tell you to go through the hospital route. Everybody's gonna tell you have to put in time through med surge. At the very least, put a year in, put 2 years in, get a general foundation of your nursing skill set, right? Set that up right when you go to graduate. I think a big part of that is they just need bodies in med surge. I think they just want people to go through med surge. Yes, to get a general foundation, but I think they also just need bodies because I think people don't like med surge. I think the people that like med surge are very far and few, but a lot of people are there because it's just a job, right? You're there. You're still providing patient care. You're still helping people. But I think a lot of people eventually want to get specialized, right? ER, ICU, a cardiac floor, oncology, like all these other areas. Med surge, it's not that it left a bad taste in my mouth, but it's just not anything that I enjoyed doing, if that makes sense. And then as I went through ER and ICU and all these others, right, I wasn't seeing anything that I enjoyed doing either. And then eventually I realized it's kind of a hospital setting too, right? Like I just don't enjoy this place of employment. It's not my thing. So I started to feel a little lost. I started to feel a little disconnected. I started to think, hey, like, was it actually smart that I became a nurse? And that's why I think it's important to make these videos, because I know there's other people like me. I know there's other people that feel this way, especially men, I imagine, because a lot of men don't grow up wanting to be nurses. We just want a good job. We just want a job that provides a good steady income. Yes, we want to help people, but there's so many different ways to do that. As a nurse, there's so many different ways to do that. And for me, who was someone who kind of paved my own path, doing things a little unconventionally, doing things a little differently, kind of going against the grain, I just want you guys to understand there is a pathway for you. There is something there for you, and you just got to go out and find it. Maybe you have to take a little bit of a leap to get there, go against what people are telling you, but ultimately things are going to turn out and be okay. And that's kind of what I ended up realizing over time. I had to pave this path myself, see nursing as just a career, right? Just like any other job. And it's a good steady source of income for a man, right? To provide for his family, to be able to provide for himself. So I guess what I'm trying to get at is, in nursing school, I continually heard from instructors and professors and everybody, clinical instructors, hey, you got to go through a hospital. And I was like, I don't like this. Well, do a year. I don't really know if you got to do your year. Do your year of med surg. Do your year of a hospital experience, and then you can branch out to public health or psych or something else that you're thinking of. Correctional nursing was never on the radar, never. And that's where I ended up. So that's my point. My point is that you just don't know, right? You don't know, but there's a place for you. So for me, it was correctional nursing. For you, it might be psych nursing. For you, it might be public health. For you, it might be maybe get a good opportunity at an insurance company somehow. There's different places. So just because you don't want to work in a hospital, there's a different place for you. You're going to find it. So friends, I want to touch on specifically why I don't like the hospital setting. There's a couple of them. Maybe you can relate to it. Maybe you feel the same way. Maybe you completely disagree. Maybe you're tolerant to them. For me, I am intolerant to them. That's why I didn't go and work in a hospital. That's why I didn't work bedside, right? The first one I wrote down is just customer service. There's a certain expectation when you work in a hospital as a nurse to provide customer service. And that's a portion of being a nurse that I never fully could wrap my head around and enjoy. I'm there to help save a life, right? I'm helped to get someone medically stable. I'm not necessarily there to do the customer service part. I will do it kindly, but do I enjoy doing it? No. When I was doing my clinical rotations in nursing school, this was something that really was a turnoff for me. I felt like I was doing so much customer service, so much, hostess work, waiter work, that it just didn't feel like I was actually studying, putting all this work to go become a nurse. It's like I would provide patient care, but if I forgot the orange juice, if I forgot the blanket for this patient's family member, right? It's like all the work that I put in didn't really matter as much, because now their experience was, oh, well, this nurse didn't really pay attention to me. But the end result was still the same, right? They got healthier. They came to the hospital because they were sick, and the end result is they got better, they got healthier, they got stabilized, and now they can go discharge home, right? But because you forgot something, maybe because the way you presented yourself wasn't super friendly that day, they remember that. And I understand it, it's the full picture, but there's a lot of expectation on a nurse in a hospital to not only care and be a great clinical nurse, but to also be a very customer service oriented individual. And I think that's a big task to ask for a nurse, because as a nurse, you are the face, right? You're with the patient way more than a doctor is. A doctor comes in, they could spend 5 minutes even with the patient, clinically do their assessment, diagnose, follow up, and they're out of there. As a nurse, you're there multiple times in the room, multiple hours throughout the day, multiple nursing shifts, right, coming through, making contact with this patient. So it puts a heavier load on you. So I feel like nurses should actually be appreciated more, paid more, and things like that, or completely just remove the customer service portion of their role in the hospital. Give that to somebody else. That's just my thoughts. And this kind of goes hand in hand with the next one that I had, that patients and families require a lot of attention. So for me, I found a home in corrections, right? These are patient inmates. They're in prison, right? They're in county jails. There's no family there that you have to attend to. Customer service isn't really there. You have to be kind and friendly and respecting, right, of them as an individual. But that expectation isn't there. There's no customer service portion. These guys come in handcuffs. You have to treat them in this environment. So that's kind of what attracted me to correctional nursing in the first place, was just that dynamic. So it's completely different. And then as well, friends, I wrote down that there's an emotional component, right, that takes a toll when you're caring for someone in a hospital. To emotionally support someone, right? I work in a prison and I don't have to emotionally support some, patient inmate, and it's because they don't want you to, right? It starts to become an issue when you get that close to someone in that setting. In a hospital, you kind of do have to provide this level of emotional support. you walk into your patient's room and you see a patient struggling, right? Now you have to emotionally be there for them on top of already taking care of them medically. It's a big burden, it's a big role. Burnout can happen quickly. And I think that's why a lot of nurses ultimately over time start to feel this way, this sense of weight, working bedside. It's a big responsibility, right? You walk into your patient's room with your meds and you see that they're crying. Well, now you have to kind of be there for them emotionally, right? And that could take a toll, especially on a 12-hour shift, considering this is one of maybe your 3, 4, 5 patients, right, that you have for that 12 hours. So it could take a toll, if that makes sense. I almost wish that that was a whole nother role of somebody else, because it's a really broad role as a nurse, really big shoes to fill. Right? And another thing, friends, this one's a little bit more of a smaller one, but 12-hour shifts are a thing in a hospital. Ever since I got a taste of 8-hour shifts, I actually prefer those better than 12 hours. Yes, you're there 5 days a week, but when you work 12s and you work 12s consecutively, it almost feels like you don't have any life for the 3 days, right? You work 3 12s, that's 36 hours. If you work them consecutively in a row, which I remember from nursing school, I didn't really like that. I didn't like going to work, coming home, taking a shower, eating, going straight to bed, waking up, going back to work, doing the same thing over again. I liked the 8 hours when I got a taste of it. I wake up at 7, go to work, right? Come out at 3, I got a whole afternoon, still got my day, right? So that's the sequence that I prefer. It's just a small preference. And then overall, friends, I put just the vibe of the hospital, the customer service portion, the emotional support portion, the expectation, the burden that is the responsibility of being a nurse, right, in a hospital. Also not having windows and other things like that. But, I can't complain about that too much because I do work in a prison. So sometimes you do work in an area where they don't have windows, but it's just the overall vibe, right? The energy in a hospital. I just wasn't for it and I just didn't enjoy it, and those are the main reasons why. Maybe you can relate to some of them. So now for this question, friends, how was I able to avoid the hospital setting? So as I've been alluding to, kind of explaining a little bit throughout this video, for me, I work in correctional nursing. When I graduated nursing school, I was like, how, do I have to go work in a hospital? It was a big, difficult moment for me to process. So hopefully you guys don't have to go through the same thing by watching this video and allowing someone who's made it already look back and say, hey, you don't have to work in a hospital. You will make it just fine. You got to pave your own path. It might be different in certain ways, but you can do it if you really don't want to work in a hospital. As opposed to me hearing it, being the only one that felt this way when I first got out of school, and just feeling disconnected, feeling like I have to go work in a hospital, like everybody's saying I have to. The instructors are telling me, the clinical preceptors are, everybody is kind of telling me, in their role, right, who is to teach me, hey, you got to do this. And I was just like, nah, I don't really want to do this. So take it from me, friends. You might have to pave your own path, but it is possible to skip it. It's possible to skip the hospital. It's possible to skip the bedside. You just got to do things differently. The worry was always like, oh, what if you're not employable, right? What if you lose your nursing skills? Well, guess what, friends? I never plan to go work in a hospital. I will never require that skill set. What matters is the knowledge, the nursing knowledge that you gain over time. And a lot of that you gain through different settings, right? For me, it was correctional nursing. Maybe you gain that by working in the public health sphere. Maybe you become a psych nurse and that's just what you do, right? There's so many different areas. So don't let that be a fear like it was for me, because it ultimately was one thing that continually tried to pull me back, but eventually I had to make that decision. And I made it, friends. When I was going to enter the workforce, I didn't apply to a single hospital. I was going to, I was getting ready. I made connections with my, floor manager at the place I was doing my preceptorship in my final semester, right? Trying to build that relationship, that bridge. So hopefully when I went to apply, I had a better, shot of getting hired, right? It was like a local hospital in my local hometown, and I never applied. I told her I was gonna, and then eventually I decided, you know what? I'm gonna do what I wanna do. I'm not gonna do what people tell me to do. I hear their advice, I processed it, but ultimately that would be a miserable life for me. So I'm not gonna go that way. I started looking at psych facilities. I started looking at correctional facilities, right? Prisons, county jails, state prisons, and I found my home that way. I found my floor, and I have enough general knowledge now that then I can utilize that for somewhere else. And somewhere else, friends, some other examples, for me during COVID was a hard time. I was like, man, I don't wanna work here, but I don't wanna work in a hospital, right? I'm kind of done with the prison. I started looking at insurance companies. I eventually started applying. I eventually heard back, and I didn't ultimately take it, but it gave me a sense of, hey, you're not stuck, working in the prison if you don't want to work there anymore. There's other avenues. But you just got to find it, right? In the prison, I work in appeals and grievances. So then I leveraged that experience to go work for an appeals and grievance department for an insurance company, pivot that way instead of still going to the hospital. So there's ways to pivot out of this. So just keep that in mind. And as I continue to ramble, friends, hopefully you can gain some sort of mindset, knowledge, general basis of how I look at things through this video. I ultimately want to create value, so I'm gonna wrap it up with this, friends. My general advice for you. Is it possible to avoid the bedside? Is it recommended? Do you have to work in a hospital? Can you avoid it? Is avoiding it recommended? Is it possible, right? So I'm not gonna be that person to tell you, hey, go work in a hospital, because I know what it feels like. I'm gonna be the person that tells you, hey, you don't need to work in a hospital. You will be just fine. You might find some challenges that someone who goes and works in a hospital may not find, but that's okay, right? Because eventually you gotta find out what works for you, and you gotta follow your path. What your path looks like isn't what someone else's path looks like. So follow what is true to you. So my advice, friends, is that follow what is true to you. If you don't want to work in a hospital, don't work there. Make it happen regardless, in a different way. You're still a nurse, you're still licensed. You're gonna find a place for you. You can follow my exact path if you want to. I started working in a county jail. I got hired out of school, went to a state prison. The prison system has so many different clinical areas in there, but guess what? It's not a hospital. They have a small ER, they have an outpatient clinic, they have public health, they have psych, they have like an inpatient unit, right? They also have grievance and appeals department, which is where I work, which is more of an administrative job. So there's different places, right? You can follow my exact path or follow your own, friends. Just know that there's other avenues for you. It is possible. You can do it. And that is just my general advice. And that is my answer to if you have to work in a hospital. Again, I'll reiterate, you don't have to. And as always, friends, I hope you can find some value in this video. I'm gonna continue to be here, give back some of this knowledge, and hope to just be helpful. See you on the next one.